Who's our next guest? Mr. Jason Tardio, the President, Chief Operating Officer, Immunic Therapeutics, their ticker symbol IMUX. Beck with us here on the Big Biz Show.
Well, because he had to hide out. They were in a quiet period. We were blowing up his phone trying to get him on the air, not realizing he was in a quiet period.
Leave you alone.
Sorry about that, Chase. Like, why is this?
Not a problem at all.
Hey, talk about let's jump right into it, because you had an important data readout on phase 2 data and had a big press release come out, and talk about what's going on.
Yeah, so we recently reported outcomes of a phase 2 study that we had in progressive forms of multiple sclerosis. The study was called the Caliber trial, and the goal and objective of this respective study was to determine whether or not our lead program, a medicine called vidofludimus calcium, could potentially have benefits in the subsets of multiple sclerosis that are defined by just pure progression. And the reason that this was important is that this is the highest unmet need within the multiple sclerosis disease landscape. There are very few therapies approved to address progressive disease, only one currently approved treatment option for primary progressive multiple sclerosis, and no approved therapies for non-relapsing or non-active secondary progressive MS. So we're excited to share these results.
This is well, for me personally, because both my mother and my daughter both suffer from MS, and there are two different types of MS, and MS presents itself differently in almost every person. But what you guys have accomplished here, what you're seeming to accomplish here, is earth-shattering in the MS world. I mean, it is like when it's like when suddenly there was a different treatment for solid tumor cancers versus blood cancers in the cancer world. I would say that's the equivalent. This is really, really novel.
Yeah, so the way that I would describe it is that this is the holy grail of drug development in multiple sclerosis. Again, there are 15 to 20 therapeutic options to address the relapsing forms of the disease, which is characterized by inflammatory activity. But as I've mentioned previously, there's little to nothing to treat the progressive forms of the disease, which is highlighted by specifically neurodegeneration. And so we reported results last week that clearly show that our medicine, vidofludimus calcium, has an impact in this subset of the disease. And specifically, we showed a 20% reduction, relative risk reduction in confirmed disability progression in this total cohort of patients that included both non-active SPMS patients and primary progressive MS patients. But more importantly, in the primary progressive subtype, we showed a very robust 30% relative risk reduction in confirmed disability progression compared to placebo. So again, we're quite excited about these results and believe that we might have a path forward to a phase 3 confirmatory study in specifically in this subtype of the disease.
Jason Tardio, the President and Chief Operating Officer, Immunic Therapeutics, ticker symbol IMUX, visiting with us here today.
Hey, Jason, I have a question. I don't think I realized there were these subsets of MS. So if someone does not originally have the progressive form, can they develop it, or is it you have one or the other?
Yeah, so most patients are initially diagnosed with the relapsing forms of the disease. About 75 to 80% of patients initially get a diagnosis, again, with the relapsing forms of the disease. But eventually those patients over time will progress into these progressive forms. Okay. There is a subtype of the disease, as I just mentioned, called primary progressive multiple sclerosis, in which patients are never diagnosed with a relapsing or inflammatory aspect of the disease, that they're purely diagnosed with a progressive form. And this is marked by just continual and gradual both physical and cognitive decline. You don't have these relapses or these flare-ups that are associated with the relapsing forms of the disease. And there's probably about 5 to 10% of patients or so that are initially diagnosed with just primary progressive multiple sclerosis.
Jason, I've got to talk about drug differentiation, because my daughter has relapsed MS. My mother had progressive MS. My daughter benefits from infusions every 6 months and lives a pretty normal life, frankly. And of course, my mother is not able to use infusions. It's a different sort of a deal. Talk about the differentiator in the different current drugs, and then how you guys overlay in terms of the future, assuming everything goes right with the FDA and studies and so on and so forth.
Yeah, so multiple sclerosis is characterized by both neuroinflammation and neurodegeneration. So ideally, what you want is a medicine that addresses both of these facets of the disease. The medicine that you mentioned that your daughter is on, and most of the medicines approved today, virtually all of them, only work on the neuroinflammatory aspect of the disease. The beautiful thing about vidofludimus calcium is it is the first dual mechanistic approach to address the full spectrum of the disease. It inhibits an enzyme called DHODH, which provides potent anti-inflammatory benefits. It also is an activator of a nuclear receptor called NER1, which provides neuroprotective benefits. And so that's, I think, the first clear difference between our medicine and other medicines that might be available today. There's also the convenience of our medicine that it's taken as an oral tablet just once a day. So
not a 6-hour infusion.
yeah, it's certainly a little bit more convenient for patients because they can just simply take the medicine in the convenience of their home. I think another differentiator of our medicine is that it's been to date, the data that we have seen show that the medicine is very safe and very well tolerated. And again, this is multiple sclerosis is a chronic disease, and so patients and individuals living with the disease need to take these medicines from diagnosis for the remainder of their life. So safety is a big consideration. Tolerability is a big consideration because we certainly don't want patients feeling worse than the disease themselves. And many medicines, unfortunately, make those patients feel worse. And so we're very excited about the totality of the data that we've seen to date with vidofludimus calcium, and believe that the total value proposition could certainly be a medicine that might be worthwhile for many patients.
Hey, Jason, if we talk about what you're focusing on for the rest of the year, is it capital for future studies? Is it runway in terms of partnerships? What are we thinking about over the next? We got 8 months left in the year, and then we got another 18 months before we're going to see another big FDA hit. What are we thinking here for the next little while?
Yeah, so I think from an operational perspective, it's we're hoping to finalize enrollment and recruitment for the ongoing phase 3 program in relapsing multiple sclerosis. Again, we've guided towards readout and completion of those studies in the second half of next year. Yeah, look, from a fundraising perspective, yes, clearly we're always looking for ways to increase capital. And we're in conversations with an existing group of PIPE investors. We did a PIPE investment led by BVF and some other big funds about a year and a half ago. The second tranche of that, or $80 million, will be triggered upon public dissemination of the data that we just released last week. And so we're in negotiation with those investors to hopefully pull that through. Sure. And then, of course, partnership discussions remain intact. I mean, there's, as you can imagine, to have an oral medicine that could work both in relapsing multiple sclerosis and progressive MS is something that all major pharma companies would have an interest in. So we're having advanced discussions from that perspective as well.
By the way, a PIPE investment means private investment into a public enterprise or public entity, which means that typically in the life of a public company, there's only 2 times that the public companies actually get the money: an IPO or a secondary offering, or otherwise known as a PIPE. But it's not. It's actually a private, not a public sort of thing. So it's interesting you guys are going through it. In fact, we'll do an infotainment sort of thing here in the weeks to come to talk about that as that comes to fruition for you. Jason, thank you so much.
Jason Tardio, the President Chief Operating Officer, Immunic Therapeutics, IMUX, came up from underground, saw the sun, got some fresh air, and jumped on the show with us. Jason, thank you.